Good afternoon to all. Let's all please stand for a word of prayer.
Let us pray the Lord's Prayer. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. For thine is the kingdom, the power, and the glory, forever and ever.
Honorable Roosevelt Skerrit, Prime Minister of the Commonwealth of Dominica and Chairman of NEPO. Honorable Reginald Austri, Senior Minister and Minister for Housing and Urban Development. Honorable Rayburn Blackmore, Minister for National Security. Honorable Dr. Irvin McIntyre, Minister for Health, Wellness and New Health Investment. Other Honorable Ministers of Cabinet, Her Worship Sandra Ermine Royer, Mayor of Roseau. His Excellency Steve Farrell, Secretary to the Cabinet. Permanent Secretaries, other senior government officials, chairpersons of NEPO subcommittees, other members of NEPO, distinguished guests, members of the media, ladies and gentlemen. Good afternoon. Let me take this opportunity to welcome you to this meeting. I wish we were gathering under different or less uncertain circumstances. As you're all aware, coronavirus or COVID-19 has affected several countries, with some cases resulting in fatalities, and the Pan-American Health Organization, or PAHO, recently upgraded the risk level of CARICOM to very high. Importantly, coronavirus is not just a health issue, but poses many implications for economic development and the disruption of normal daily activities due to the need to restrict movement in a bid to contain the spread of the virus. Coronavirus is no longer a strange disease we hear of or read about in China, Europe, or America, but it has come much closer home, as the Caribbean was not spared from being affected. A few cases have been confirmed in 3 islands thus far. Therefore, the implementation of a comprehensive plan to support preparedness and containment is paramount at this time. This NEPO meeting is convened to detail Dominica's level of preparedness and capacity to respond, including the availability of quarantine facilities, laboratory testing, capacity, and hospital readiness, among others. As we have seen over the past few months in the response of other countries such as China and Italy, a multi-sectoral approach is critical in the containment of this virus. All stakeholders here today should by now have fully thought of their plan of action on how to contribute to this national effort. While the national system will do all it can to safeguard the lives of the people, the public must remember that they too have a great responsibility to do all they can to keep safe. We therefore implore the cooperation of the general public to listen to and follow the advice by the health authorities on basic actions to protect themselves and each other. We hope that this meeting will provide well-needed information and plan of action to ensure that any effect from coronavirus will be minimal, particularly on the most vulnerable groups. Again, welcome to all. At this time, I hand over to the Honorable Chair of NEPO, Honorable Prime Minister Roosevelt Skerrit.
Thank you very much. Let me greet everybody present. The Senior Minister, Minister for Housing, Honorable Austri, Honorable Blackmore, the Minister for Home Affairs, Honorable Dr. Irvin McIntyre, Minister for Health, and my other cabinet colleagues present, CAPSEC, Financial Secretary, Permanent Secretaries, all of you present. through in the Ministry of Health, you know, we have been engaging ourselves on this matter from the moment this was made public. And so the Ministry of Health has had numerous engagements, not only within the Ministry of Health, but engaging other stakeholders and to work with stakeholders in putting a national plan of action in place to prepare ourselves for any possibility or any eventualities. As we all recognize this, COVID-19 knows no boundaries. We have also found out it knows no races, and it knows no ideologies, it knows no religion. And therefore, as indicated by the World Health Organization, this is a global issue, and which must be addressed and viewed from a global perspective, and not the pointing that finger at any one country or any one race or any one religion. The Minister of Health has attended every Ministers of Health meeting at the CARICOM level by video conferencing. And also we have been in touch, as I'm sure he'll tell us later, with PAHO. We rely heavily on the advice and the guidelines and guidance given to us by PAHO, the Pan American Health Organization, also CAFA, our regional institution, and the WHO. There was a recent CARICOM heads meeting that was held in Barbados last Sunday. I attended along with the Minister for Health, and we were gathered in Barbados to discuss this issue and to review the preparedness of CARICOM countries, and also to review and to adopt a protocol which we hope will be which we expect all member states to follow in the respective countries. Now, most times we meet at NEPO, it has to do with hurricanes or flood or earthquake and so on, but the cabinet felt that it was necessary to convene a meeting of the National Emergency Planning Organization so that the Ministry of Health could appraise the various stakeholders beyond the public officials, because in large measure it is within the public service that we have been dealing with the issue, and we want to ensure that people recognize that this is not a Ministry of Health issue, neither is it a government issue in the narrowness of the definition of government, but this is a matter which the entire country needs to be seized with and need to get factual, accurate information as to what each of us as individuals ought to do and what we can do as organizations and institutions, the private sector, the churches, etc., etc. Because in this era, we are bombarded with a lot of fake news, and sensationalism now has become part of the DNA of the society these days, and people get more excited when they see ignorant things being peddled on the social media, and they pay very little attention to facts and accurate information, and we sensationalize this thing. This is not a matter to bring any sensation. This is not a matter to take lightly. This is not a matter to make or to treat as any partisan political issue. This is a matter that each of us must take seriously, and it can impact any one of our countries, it can impact any one of us, it can impact any member of our family. And so we wanted to call us there, and we have taken the extraordinary action, which is not customary of NEPO, but to carry this NEPO meeting live, because we wanted, and we want the entire public, the entire citizenry of Dominica, to get the facts as they are, to get the information, accurate information, so that we can treat with it in a responsible manner. but clearly this is a matter that that preoccupies the minds of leaders of the world, leaders of the Caribbean, the health leadership of the sub-region, the health leadership of the world, because we are seeing it getting, it's now within the region, you know, and we all interact with we have a borderless region in many respects, and so while we hope and pray that it does not spread in these islands or countries where it currently is in the Caribbean and of course beyond the borders, but it does not get to our country, but at the same time we have to take certain actions. We have to take certain preemptive and proactive actions to ensure that we can do all what is humanly possible to prevent ourselves from contracting this COVID-19. But to say to you and to say to the citizens of Dominica, we are sparing no effort from the government standpoint. It is something that we treat with on a daily basis. The cabinet discusses this every Tuesday. We receive updates from the minister, and to ensure that we have a mechanism of assessing and reviewing our preparedness every step of the way. I know these things cause anxiety within the population, and it's natural for a human being for things like that to cause anxiety. But I always tell people, you know, if we become too anxious, then we will not be able to function properly. We become paralyzed, and if you're paralyzed, then it can affect your mental state of mind, and you won't be able to function properly. So, yes, there'll always be anxiety, and me telling people don't get anxious really it won't solve any problem or won't cause us not to get anxious, but we must not get over anxious. And this is why it is so important, you know, for all of us to understand that the dissemination, the propagation of information that we cannot verify is not in your interest, neither is it in the interest of he who you're forwarding it to. You understand? If you're not getting from the Ministry of Health, I know all of us go on the internet every day. We're on social media every day. We are bombarded with all sorts of videos and postings and so forth. You know, if you in yourself cannot determine whether it's factual coming from a legitimate source, please keep it to yourself for the time being, and not pass it through. But this meeting is important. We will hear today from our epidemiologist, Dr. Ahmed, and we also hear from the Honorable Minister for Health. And we have also invited the Honorable Minister of Education to do give us a short update on our engagement of our students in China and our ambassador in China, and the level of contact which we've had with our students, because in that issue also there's so much misinformation and malicious things are taking place that, you know, I don't know what human beings are coming to these days, you know, but we find some kind of excitement and self-gratification by propagating and promoting things that are not factual and things that are not true. But certainly the minister will give the public an update on what we have done on our level of contact with the students in China. But what we want coming out of this engagement today is that each of us will take the information given here today and bring it back to our communities, bring it back to our homes, so that as far as practically possible, the entire country would be seized of the facts, would be seized with the accurate information, and would be seized with what actions we can take individually, as a family level, at a business level, at a national level, to prevent this from occurring. We don't believe, and based on advice given by WHO, that we need to close our borders, because if you start closing our borders, what are the other implications? I think there are preventive and preventative measures we can take. The systems that the minister will speak about, we have put in at the ports of entry, and I believe that if we follow the protocols that have been advised by WHO and PAO and CAFA, and what was recently adopted at the CARICOM heads meeting on Sunday gone, and of course, we pray to the Most High, whether it is to Allah or to Jesus Christ, or we can certainly, whatever name you call him, but we can certainly see ourselves through this. This is a crisis of global proportions. There are many attendant economic difficulties that will follow this. It is natural. We have seen the IMF and others reduce the projected growth for 2020 based on this. They revised it downwards. But for us, for me personally, the economic impact is secondary to ensuring that it doesn't affect any citizen of Dominica, and it does not spread in the countries, in the islands, in the Caribbean that have tested positive for this, and in countries where it's been impacted, in China, in Singapore, in Japan, in South Korea, in France, United States of America, in the United Kingdom, in Italy, in Iran, and these countries, that we pray that we will not see an increase in the number of people who are tested, who contract this COVID-19, and that those who have contracted this virus, that they can successfully overcome this illness. And we pray for these countries and for the citizens, and we extend all our solidarity, our thoughts, and our profound sense of concern to all of his governments and all of his citizens of all the various countries, and to say that we all have to continue to work together to ensure that we can overcome this challenge. But the technical information I will leave to those who are tasked with that response. Pen and paper, you can write some notes so that you can reference when you go home. But we intend, following this, to be in the public as we have been, and we intend to increase this, the public education, because we believe that the more we provide information, even if we have to repeat it, it is better for all of us in the country. And we've been taking this to schools, we've been taking it to various private sector establishments, community groups, taking this forward. So I want to thank you for being here. This is the largest attendance at NEPO meetings I've seen, which, and if I am to deduce anything from this, it means that everyone is even more concerned about this than we are of a hurricane or an earthquake, and it is good. It is a good start that we are attentive, very disciplined students, and that we're here recognizing that we all have to work together. This is not about the Ministry of Health alone. This is about a national preparedness, a national response, a national understanding that we all have to work together to overcome this. I will not speak further, only to invite now a presentation from Dr. Ahmed, who is the acting epidemiologist of the Ministry of Health.
Side it is. Thank you, Honorable Roosevelt Scurry, the Prime Minister, and thank you, Honorable Dr. Roosevelt Scurry, and Prime Minister of Commonwealth of Dominica, and other members of Cabinet and Cabinet Secretary, and my esteemed colleagues at the Ministry of Health. Good afternoon. We are seeing here the evolution of coronavirus, or right now is a COVID-19 outbreak, the event that took place. Initially, December 30th, 2019 was the first 4 cases were identified at the Wuhan city, somewhere at the fish market. That's when they identified some atypical pneumonia presentation. And subsequently, they succumbed to the disease on January somewhere 9th. Hearing that information, once it reaches to the Ministry of Health of Dominica, January 10, we alerted all our healthcare professionals in order to do surveillance that we have already exist in our place. We do have severe acute respiratory illness that actually monitor the respiratory diseases that is in acute nature, and atypical situation like in what happened in China. Subsequent, we know all that, that China confirmed first human-to-human transmission on January 10, and then January 22nd, first WHO emergency committee met and discussed the corona situation. However, they did not declare as the event as a public health emergency of international concern. During that period, Ministry of Health actually went ahead and did several activities in response to preparation for this outbreak. And January 30th, that was the first time WHO declared this event as a public health emergency of international concern. By that, actually, they meant that this event cannot be controlled within the border of People's Republic of China. So as a result, all other countries are given the authority to go ahead and implement their plans that is in place. This is our national influenza preparedness plan. And subsequent to that, we went through several activities to train, to prepare ourselves and get ready just in case the event actually reaches our shore. Great. Okay, in terms of epidemic, globally, that is, total confirmed cases as it stands for actually as of March 4th, just about now, 3 p.m. Dominica time, 95,079 cases. Total death as it stands, 3,249 cases. And China and its territories represents 84%. However, the outside of China, we are seeing number of countries with increased cases of coronavirus at this time. As of today, total number of countries that are reporting coronavirus, 75. This number actually drastically increased to 75. Beginning of February, it was only 24 countries that were involved in coronavirus, and now within a month, it's 75 countries been reporting those confirmed cases of coronavirus. And a cumulative figure for those 75 countries include over 11,000 confirmed cases of coronavirus and 172 deaths, of them mostly coming from Iran, Italy, and South Korea. The countries that are reporting local transmission of the cases include People's Republic of China, Iran, Italy, South Korea, Japan, Germany, France, Spain, and Singapore. So these are the countries are reporting the local transmission, that is. Sorry, my apologies that the USA figure is not updated for today. However, it was yesterday 103 cases, but 9 deaths so far, and 15 states involved in confirmed cases of coronavirus. Other than United States of America, we also have Canada, Ecuador, Mexico, Brazil, San Martin, Saint Bart, and Dominican Republic. So these are the other countries in the Americas are reporting confirmed cases of coronavirus. Here is a daily trend in terms of global confirmed cases and versus rest of the world other than People's Republic of China. As you can see, global trend is downward as we can see from January 23rd to March 3rd, trend is gradual downward. Whereas rest of the world, other than People's Republic of China, we have increasing trend. So this is bit worrisome at this point in time. In terms of proportion of confirmed cases, China versus rest of the world, as you can see, the pie was for rest of the world very slim and thin at the time of February 21st, but by March 3rd, that pie got much larger, and the proportion represents about 12% of the total number of cases, whereas China represents 88%. This is the distribution of confirmed cases of coronavirus outside of China. As you can see, South Korea represents almost 46%, Italy 18%, and Iran 15%, and rest of the world, including Diamond Princess, one of the cruise ship, also represents a huge portion of the confirmed cases. This slide is important because it tells us where this outbreak is heading. So in terms of total number of death rate versus recovery rate, as you can see, February 2nd, it was very high. Death rate was very high, recovery rate. The difference between these two were narrowed. However, as the day progressed, the recovery is actually more patients are getting recovered. On the other hand, very few are dying from this coronavirus. Now, in terms of virology of this coronavirus, we know coronavirus is actually a family of corona. There are other viruses also part of this corona family. SARS virus, MERS virus, MERS-CoV virus. So this is coronavirus. Its incubation period based on CDC analysis is 2 to 14 days. There are some outliers, 0 to 27 days, but there are different explanations to that. Fatality rate as of today in Wuhan city, actually 2.4%, 2 to 4%, my bad. And outside of Wuhan and rest of the world, including rest of the world, is 0.7%. So that's a good thing that outside of Wuhan it is much, much lower, less than 1% actually. And most of the case fatalities is among over the age of 80 years age group, and that represents roughly about 14.5% of that age group. And there has been report of no case fatality among the 0 to 9 years age group. In terms of transmission rate, this coronavirus is actually a little, in terms of transmission rate, it is higher than flu virus. That's the interpretation of this. There's one confirmed case can spread, potential to spread to 2 to 4 persons. So in comparison to measles virus, if I may say, if there is one confirmed case of measles virus, that can potentially spread to 18 other persons. So if there were two measles confirmed cases, the entire room will be transmitted to all other members in this room. So in terms of transmission rate, it is a little higher than flu virus, but much lower than other airborne diseases like measles and even chickenpox. Now, clinical presentation of this coronavirus. So far, WHO and the Chinese authority, Chinese CDC that is, they conducted some study among the 72,000 lab-confirmed cases of coronavirus. And they found that 81% actually presents only mild symptoms. And those mild symptoms include basically common flu type of symptoms, presenting with fever, 98% of the cases, and some dry cough. They also calculated their recovery phase for those mild patients, 2 weeks, roughly about 2 weeks. In terms of severe form, they also found that 14% represent the severe form of coronavirus, and they represent shortness of breath and pneumonia. This is very typical for this coronavirus as compared to other flu-like symptoms or influenza-like illness. Pneumonia represents almost 100% of those severe form of coronavirus. The good diagnostic procedure, they found that CT scan and X-ray clearly show there is a pneumonia, signs of pneumonia, those severe cases. Recovery for severe form or critical, 3 to 6 weeks. That's about the range. Critical, those who progress to critical form, only 5%, and they may develop into respiratory failure, septic shock, and multi-organ failure. So this is pretty much the picture of how coronavirus infect and their progression. They also documented that those who coronavirus actually mostly affected by the mortality in terms of those who died who had the chronic condition. They had underlying disease like hypertension, diabetes, cardiovascular disease, Parkinson's disease as well. So with that in mind, I will stop here and let our Honorable Minister speak. I'm sorry.
Good afternoon to everyone. Let me recognize the presence of the Honorable Prime Minister, who is also the Chairman of the National Emergency Planning Organization, and the Honorable Rayburn Blackmore, Minister of National Security and Home Affairs, under whom the portfolio of disaster management falls, Senior Minister Reginald Austri, other ministers of government and cabinet colleagues, Ambassador Steve Farrell, Secretary to the Cabinet, permanent secretaries, members of NEPO subcommittees, senior officials, and other staff of the various ministries and organizations, the media, good afternoon again to all. Today I want to just give you an insight into the activities and the actions that have been done by the Ministry of Health. We are fully aware that we are facing a situation that not only health can handle, which is why we've brought in all the stakeholders so that we can get a comprehensive approach and the best possible outcome as dealing with the coronavirus. The Ministry of Health and Wellness and New Health Investments in the Commonwealth of Dominica has been monitoring all alerts and other communications in relation to COVID-19. The ministry has increased preparedness measures through heightened surveillance system, educational sessions, and dissemination of public health information through the media and other mediums. A press release was sent out to the media on Friday, January 24th, detailing the preliminary information on the novel coronavirus 2019. A press conference was also held on January 24th. That is held and spearheaded by me in the Ministry of Health, Wellness, and New Health Investments. I was accompanied also by the Ministers of Tourism and Education, the Chief Medical Officer, the Permanent Secretary, the Parliamentary Secretary within the Health and Wellness Ministry, and the Health Promotion Unit. That was followed by a series of media discussions from February 11th to the 14th, including 2 television interviews with mapping and GIS. These discussions provided information on the virus as well as advice to the public to exercise the usual precautionary measures, including hand washing, respiratory etiquette, and cleaning of surfaces. Educational sessions continue at all primary and preschools around the island, the nursing homes and business places in the city, such as the National Bank of Dominica, the NCCU, the Social Security, and this will be ongoing as time goes along because we want to make sure that all the corporate sectors are involved in the training session. Apart from these, we've done most of the schools in the northeastern coming down to the west coast, and we're approaching the south now, so by the end of this week, we would have completed all schools. When we are bringing this information to the schools, we're also encouraging the children to bring that information back home so that the information can reach as many people as possible. Let alone that sort of information that we give into the schools and to the corporate sector. We are also repeating these training sessions and these health promotional activities. So we don't just go once and we forget. We do it once and then we repeat it and we go again and again until that the message does eventually sink in and that everybody gets the message and they can propagate the message so that the entire country is on alert and is aware of what's happening as well. We've also done education sessions with the customs, we've done educations with the fire and ambulance, and we've done education also with certain other stakeholders in the whole fight against the coronavirus. Let alone all these health promotion measures that we're taking. We're also providing what you call alert cards. As a matter of fact, we printed 3,000 alert cards. And these are cards we put at the different public areas, whether it's in schools, whether it's in the banks, that people have access to the information. And we have also taken it to a next level that we don't just print these cards in English, we also have these cards in Spanish and in French. So when you get a card, whoever it may be, the information is there. And we're encouraging people that when you get a card and you read the information, you can pass it on to someone else who maybe didn't get a card or wasn't at a place where the cards were available. So these are all the different measures that we're taking in terms of the health promotion aspect of it. We have also little flyers that we give at the schools regarding the hand hygiene. You know, the thing about this coronavirus, you can have all the fancy equipment you have in the world, molecular testing and all of that stuff, and the PCR machines, but the basic thing, which is all about hand hygiene, respiratory etiquette, these cannot be overlooked. These are the things that really spread the virus. So we can talk a lot about the facilities, but also these are the preventive measures that we must not overlook, and we have to emphasize time and time again. That is why every time our health promotion unit, we keep stressing those simple, basic. It doesn't cost anything to wash your hand, maybe a little hand washing liquid. So these are the things that we're emphasizing, and these are the things that we want the public to know, and that's the best way we can actually have a better effect in terms of protecting ourselves and being prepared as regards to the COVID-19. Apart from all of this, the different stakeholders in this fight against the coronavirus. So we have the customs in particular, that's one of the stakeholders as regards to our preparedness section. The Customs Division has already taken precautionary measures to ensure that all ports of entries are equipped with adequate and basic protective and sanitary gear to guard against and reduce the frontline officers of the Customs Department who are exposed to anyone who may be at risk coming in. Let alone that, one of the major areas that we face is in the yacht industry. This is really a semi-regulated means of travel and maybe an avenue for risk, in all fairness, for the customs and immigration officers and for the country as a whole. So the controllers of customs within the Caribbean region also voiced their concern on this matter via CARICOM Impacts video conference held recently. So what has been done in this recent correspondence with the Permanent Secretary of Caribbean Customs Law Enforcement Council, that is CCLEC, 2 kiosks have already been shipped. with live online system called SailClear, RCS Vessel Clearance System, which can assist the region to manage a potential coronavirus outbreak by utilizing pre-arrival notifications. This will mandate that masters of all pleasure yachts, go-fast vessels, and inter-island vessels use the SailClear system to submit online declarations regarding their vessels, passengers, and luggage to customs and immigration. Because the yacht is, well, now is a season when we have lots of yachts in Portsmouth, and it might be a little difficult managing that issue. So this is where the entire Caribbean has come together, and they're providing these 2 yachts so that Dominica can be part of the program. All the other islands are also getting their 2 kiosks, and so that we can monitor the yachts coming in. It's much easier to monitor through the airport and maybe through the ferry terminals, but to monitor the yachts is a bit of an issue, and that is exactly why the Caribbean has come up with this solution that we can more effectively monitor our yacht system. Then that's from the customs point of view, one of our major stakeholders. Then immigration is also another major stakeholder in this fight against the corona. And the Immigration Department is responsible for manning 6 ports of entry. That is the Douglas Charles, the Canefield Airport, Roseau Ferry Terminal, Woodbridge Bay Port at Fokole, Portsmouth, and Ansdene Port. And the system of sharing information with the arrival of passengers from the People's Republic of China or other hotspots is in place. That is done through the API, which is an advanced passenger information. So if we have that sort of information, it makes it much easier for us to know when someone is coming from the People's Republic of China or any of the hotspots, so that we make arrangements at our port of entry that we can put all the precautionary measures in place when we have passengers like this coming in. And so far, it's been working pretty well. So as soon as these people come in, our port health officers are there, the interview takes place, and then, well, all of them have been asymptomatic, so the interview takes place, and then we make arrangements that they can get home quarantine. Granted, but that is where the public comes in into that. So you have to play your part, that if you know of anyone coming from those areas, just in case that the advanced passenger information misses someone, you can assist us and letting us know, so that we have a double approach, a more comprehensive approach to find out anyone coming from those hotspot areas or the People's Republic of China. So the public has to play its part as well. It's not just the Ministry of Health and the other stakeholders. We're expecting you all to make a significant contribution as regards to advising us and giving us information on those passengers that you might know that maybe we might just not have picked up. As relates to the Yachting Committee, from immigration point of view, I mentioned earlier how the customs have put something in place to handle that aspect of it. Our next stakeholder in this fight against the corona is the fire and ambulance. And we have trained and we have conducted training for all the brigade headquarters staff and 3 representatives from the other out-district stations. That was done on the 7th of February. And in proper personal protection and handling cases or handling suspected cases. The training was conducted by Nurse Blaise of the Infection Disease Unit, and then periodic revisions and update of information to all staff as per the procedures to be taken. We've also identified and separated 1 ambulance station at the brigade headquarters for use as a main vehicle for response to suspected cases, because obviously we cannot have the ambulance handling the normal patients and suspected cases. So an ambulance has been identified, and that ambulance is the one that we'll use if at all we have to use it for any suspected case. That is just being highly precautious, that we cannot have the general public using the ambulance that might be used for a suspected case, which is standard protocol in any case. Then we have been collaborating with Mr. Hogan at the hospital services in assembling the response protocol for the ambulance as well. And we have submitted an initial list of the personal protective equipment to Nurse Popon, that's the senior CHN in the Roseau district, for submission to acquire immediate stock for use in the ambulance. We already have, but we need to get more, and we need to have on standby, because we just cannot just have a limited stock, and when it runs out, we don't want any stock out in that regard. So we want to make sure we have excess and surplus that we can deal with any scenario. And the brigade is currently in the process of receiving invoices for supply of stock of necessary PPEs, and what has been made available is 12 hazmat suits for use on the ambulance. So that's how the ambulance sector and we have identified, we have areas for them, and we know exactly, we've been training them, and we continue to train them, and provide the equipment for them so that they can carry out their functions in a safe manner. But if we've done it with the customs, we've done it with immigration, and we've done it with the ambulance system, then we come to the Princess Margaret Hospital. At our accident and emergency department, obviously we cannot have any suspect case mixing with our normal patients accessing the accident and emergency department. So we have a separate entrance for suspected cases. We have our challenges in the sense that we are building a new hospital on an old hospital site. But in spite of all of that, and regardless of that, I must commend the staff of the Princess Margaret Hospital in how we've made or how we've carried out our preparedness regardless of all the construction that's going on. And we have put some measures in place that if someone were to come, that yes, we have a separate entrance for you, you'll be screened separately. And even at the hospital, what we've done, we've had a separate isolation area where we can actually isolate 8 people, and we also have the facilities for 8 other people, that is non-ICU cases at the hospital, which is, considering what the construction, I think that is an excellent job we have done in that regard, to provide all of this even while constructing a new hospital. The staff at the hospital has been repeatedly trained, and the training continues, both the doctors and the nurses and all the other staff, the ward aides, etc. So that, and it's an ongoing process, as I said, we keep training people as time goes along, because we have to get the information out there as to the basic ways how we can prevent the spread of such a virus. And when we talk about the information that the promotion, this is what you'd actually do for any virus in any case. That's what you do every year when we have the flu season. So it's just a matter of just reactivating those training and those health promotion activities that have been going on. The area, the hospital that we've chosen for isolation, it's, well, for those of you who know the hospitals at the back where the former Ross University containers were, and these are the ones we've modified that we can use for isolation. If need be that there's a patient of COVID, then yes, we have that isolation area. But we've gone a little further in the sense that we've also looked at a place at Ross University in Portsmouth where they have the containers, and this is a much bigger area. Let's assume, God forbid, that we were to get 20, 30 patients or some suspect cases and we had to isolate. This is where we've identified in Portsmouth. It's just opposite the Wee Church in Portsmouth, there opposite the huts where there are the canteens, and that's a much bigger area, and it can take as many as maybe even 20, 30, 40 isolating patients, because that's just been highly precautious, and so that's what we've done and we have identified. Obviously, your next question would be, but if we were to identify a place and we have 20, 30, 40 patients, you need staff for this. We've discussed that with I've discussed that with Dr. Lopez of the Cuban Brigade, and said, yes, if need be, and we need to get medical assistance in terms of staff, that is nurses and doctors, Cuba has agreed that yes, they can provide this for us. So that's just how we just plan ahead of time, just in case, God forbid, of course. Then in terms of supplies, because you would appreciate the fact that China is one of the leading suppliers of medical equipment and pharmaceuticals. I guess with China and India together, maybe they provide about 80% of the world's pharmaceuticals. So with almost the practical lockdown of China, and I guess everybody's just trying to keep their stock together, it is of prime importance to us that we have adequate amount of pharmaceuticals and stock. So at the moment, in terms of our supplies, we have, in terms of surgical masks, we have actually 20,000 surgical masks with us at the moment. That is of the normal surgical mask. In terms of the N95 masks, we have 12,840. In terms of isolation gowns, we have close to 1,000. And just in normal gloves, we have 1,200 cases of normal gowns. But we went a little further, and we have actually ordered surgical masks, an additional 8,000. And in terms of the other with the loop, 6,000. In terms of other surgical masks with a shield, 8,000. And isolation gowns, 5,000, and other personal protective kit, 200. So although we have quite a significant amount, we're just being highly precautious again by ordering all of these extra ones so that there can be no stock out in the event of anything happening. In terms of our transportation and our standard operating procedures for cleaning of ambulances used to transport novel coronavirus patients. This has been developed and it has been shared with the fire and ambulance service. The Princess Margaret Hospital orderlies, who will be responsible for cleaning the Princess Margaret ambulance, has also been sensitized to these standard operating procedures. And a site for cleaning of these ambulances at the PMS has also been identified. The education sessions are ongoing with the doctors and the nurses, as I mentioned earlier. Then in terms of the lab, we have our lab, yes, and with our PCR machines and all of this stuff. And in terms of the staff to do molecular testing, yes, that is available as well. We can do this. A slide on an average takes about 4 hours to get prepared. A slide that to get us the coronavirus here. It takes about 4 hours to prepare, so within 12 hours you can actually have a result. We're lucky enough that maybe Dominica is the only island in the OECS with that capacity, and that tells a lot for us. And the training was done by Dr. Gray from the Center for Disease Control. That was done about 2 weeks ago. The training is also conducted with gene expert training, which can help us with identifying, that's the more modern way of confirming tuberculosis. So the training has gone on, and we have the capacity, and our staff is ready for all of this. But having said all of this, we have to appreciate the fact that it has to be a comprehensive approach to this. And that is why the customs and the immigration, the fire and ambulance, the public, the health promotion, and the Ministry of Health have to do it together. And then we mustn't look for the more difficult approaches to those things. We have to start with the simplest approach, which is making sure we have proper hand hygiene when we cough in the public, when we sneeze in the public, how we wash our hands. These are the little basic things you and I can do that actually don't cost anything. So we really want to emphasize that those practices must be adhered to. And these are just the simple ways to deal with the virus, rather than all the other complex ways that we've been talking about. And apart from that, we have to appreciate the fact that a country can never be 100% prepared. Obviously, we try to be as prepared as possible. And even the developed countries and the more advanced countries cannot prevent the virus from entering their shores. So let alone developing countries like ours, and recently at the CARICOM heads of government, most of the islands were just straight up that, no, they can't handle it. And that was an issue we had with the cruise line industry. But it just tells you how that you can never be 100% prepared, but obviously with the resources that we have, we try to prepare our best on our ability. As a matter of fact, there's a checklist for PAHO, and PAHO actually gave us an 80% preparedness. Considering the fact that we just restructuring our health system, I think that was commendable to get 80% preparedness. But obviously, it's a fluid situation, so we keep adjusting and adjusting to see how we can get to the highest level of preparedness with the limited amount of resources that we have. So, and as I said, everyone has to be part of it. And there's a very significant point I want to raise in the sense of the fake news and the wrong information that's going on. We've been consulting with the experts, the international experts, whether it's PAHO, whether it's WHO, whether it's CAFA, and our guidelines and all what we do is based on this information that we're receiving. So you have to be very mindful where you're getting your information from. On the social media, there's a lot of stuff going on, but I'd prefer if you listen to the Ministry of Health. We'll give you a more reliable and genuine information than the social media. And with all of this, we should really appreciate the staff of the Ministry of Health. I think they've been doing an excellent job in bringing the point across as regards to their educational programs. And that's for everyone, not just doctors and nurses, all the ward aides, the cleaners, everybody that's involved. And the other stakeholders, that whether it's immigration, fire and ambulance, customs, even the Ministry of Agriculture, Ministry of Tourism. I think we've all come together, we've had repeated sessions together, and everybody's enthusiastic about giving Dominica the best protection they can possibly give. So with this is just a little, well, there are lots of other stuff I could go into the details, but this is just a little précis of all what the Ministry of Health and the other stakeholders have been doing. And the rest is for all of us to share the information as regards to our hand hygiene or respiratory etiquette. I've been saying that for the nth time here, but I know it's very important, and this is what we have to spread to everyone. Thank you so much.
Prime Minister and Chairman of NEPO, senior ministers, colleague ministers, permanent secretary, secretary to the cabinet, other stakeholders, everybody, good afternoon. The government of Dominica, especially the Ministry of Education, Ambassador Charles and the Chinese Embassy have been in touch with students, especially those in Wuhan, and we are monitoring the situation, particularly for these students, Wuhan. We are in contact with all of our 83 students all over China. Presently, we have 10 students residing in Wuhan. Get it? I get it right? They are at various universities, 2 males and 7 females, and 1 person is employed. The students have all reported to be well physically and they are safe. Movement is restricted. No outdoor activities, sporting activities or games, no congregating. These rules apply to those on campuses and for the students who live in private apartments. The same exists all over, as local authorities must follow the protocols established. Online classes have started at these universities. The lockdown order has created some anxiety for some of our students. However, the situation is not the same for all students. There are those who are in high spirits. We do make efforts to ascertain the facts of the situation. The situation that may be the case for one student might not be the same for another student. Some students are provided with supplies and meals on their campus. Others are given supplies and they do their own cooking. Some may have to purchase supplies, and for this, the government has made funds available to our students. The students are generally grateful for assistance received through the ambassador. We are there to provide all reasonable support that they need. The university regularly provides free masks, sanitizers, and other protective materials. As far as possible, they meet students' dining needs through takeout services free of charge. While students may be okay physically, we know that they're anxious. We know that they're also communicating with each other through social media and otherwise. This is a time for students to give encouragement and support to each other. This is a time for families to encourage each other and to give moral support as well. The universities have special task force in various management teams who are providing psychosocial and psychological counsel. Online counseling is available. Moreover, persons such as headmasters are in contact with students via telephone and emails daily. All universities do have essential persons on campus. There are hotline 24 hours to address students' affairs. All universities have to undertake a holistic approach to cover students in their overall framework and to advance epidemic control and the rigorous containment measures. The Ministry of Education is in touch with all our students, and we have been communicating with our parents. We had a meeting with parents very early in this battle. We commend the effort of all, especially Ambassador Charles. Ambassador Charles and the Chinese embassy do give support and are in communication with the universities and all our students. The Chinese government gives high priority to epidemic control among foreign students. The Chinese government have their established protocols in every city. The government of Dominica gives every support, and we are in solidarity with our students and their parents. Moving our students now could be very risky, as we may expose students who are healthy to the virus. We are reaching out to provide further support where it becomes necessary. We offer again our numbers, and parents of students and students are free to call at any time. Take out your pen. The numbers are 1767 276 4698, 1767 275 3607, 1767 266 3203. We encourage everyone, let us stand together against this one common adversary, which is this virus. We are confident that we will overcome and we will come out more than conquerors. Let us desist from and discourage the spread of false news, incorrect information, and mischievous propaganda. When you see it show up on your phone, ask yourself, is this true? And if it is true, look at it. And if it's not true, ignore it. And if it is true, ask yourself, is this uplifting? If it is true and it is uplifting, continue looking at it. But if it is not true and it is not uplifting, forget it. And if it is true and it is uplifting, ask yourself, is it really necessary for me to share this? And if it's not necessary, forget it. And if it's true and it's uplifting and it's necessary to share it, then share it. Remember, our God is ruler over this virus. God bless us all, and he protects us under his almighty wings. Good afternoon. Thank you. Jesus bless you. God bless you, and I love you. It will be all right.
Thank you. Let me take this opportunity and is it okay I sit there or you want me over there? I act solely on instructions, you know. So. Thank you. Let me, on your behalf and of course my behalf, thank Dr. Ahmed and all our Minister for Health and our Minister for Education for a very comprehensive update on all the actions that have been taken and of course the actions which we need to take going forward. We now move to the point of open discussion, which is an opportunity for each of us present to ask a question, to seek clarification. Let us be precise and concise with our question, avoid preambles. Let us go straight to our question and so on. If you are not sticking to those instructions, then I will interject. All right? It's open. Yes, yes, sir. Can somebody pass the microphone? Or? It's one, right? Okay.
Thank you. PMN to the Minister of Health. On behalf of tourism stakeholders, will the government of Dominica come out with an official document that indicates the protocols so that as we speak to people who are thinking about traveling and coming into Dominica, we have something official to indicate to them, whether it is what CAFA is saying but we're just looking for what the official protocols would be.
Thanks for the question. We have been preparing the protocols that you're referring to, And it was done, but the situation has been so fluid that every now and then we keep adjusting. And then I finally said that I was going to present it today, so most probably this afternoon we'll send something to the Dominica Hotel and Tourism Association, by the latest tomorrow morning, because we're going to add some other little things to it. As regards to all the activities that are going in place at the ports of entry, whether it's the Douglas Charles or the ferry terminals or whether the cruise ship berths, but yes, we do have something in place for you, and if not this afternoon, you'll get it tomorrow morning for the latest, because we've considered this and realized this is a very significant part of the whole program. Granted, tourism means a lot to all of us in the Caribbean, to all the Caribbean islands as regards our economy, but we're doing it with the safety of our citizens as well. So it's a delicate balance we are striking, which came up at the CARICOM heads of government and the ministers as well. So yes, different protocols have been put in place, and definitely you'll be receiving something before midday tomorrow for sure, which you can actually give to your other stakeholders in your tourism industry. But yes, we have considered this, and we've been in contact with all the international stakeholders, and we'll present something very comprehensive to you, which, and you're not the first person bringing that up. It has been brought up to us, and we keep tweeting it and adjusting it, but we'll give you a final one. But don't be surprised when we give you this one, we'll adjust it as time goes along, because things keep changing every now and then. But yes, you'll be given one. Just before, I just wanted to mention, because a lot of people keep asking, well, Doc, when do you wash your hands? So I'll just give you a little idea, because, and it's interesting to note that sometimes people would even use a detergent of a soap that washes off easier than another one. So a very good friend, Mr. Bad, will give me an incident where he had certain soaps in some parts of his pot, and the people complained it was taking too much time to rinse off the soap. But 20 seconds is adequate amount of time to rinse off the soap from your hands. So with 20 seconds, that should do a pretty good job. And if at all you're using a sanitizer, preferably with 70% alcohol, isopropyl alcohol. So that does an excellent job as well if you're using a sanitizer. But some of the times that you'd wash your hands, after blowing your nose and sneezing or coughing, then you need to wash your hands. Whenever you're caring for a sick person, then you should also wash your hands after this. Before, during, and after you prepare food, yes, you should wash your hands as well. And before eating, you should also wash your hands. When hands are dirty, obviously you wash your hands. And after handling animals or animal waste. So these are the 5 or 6 main times that you should wash your hands. And maybe rather than remembering these 5 or main times, just make it a habit. It's as simple as that. If it's a habit, then you don't have to remember the different times that you have to wash your hand. So let us try to stick to those, and 20 seconds would do a good job. And let's use soap, and these are the times that you should wash your hands. And then when we talk about masks quite a bit, and but the 2 of the main functions of the mask is, one, that when you sneeze, you don't let the droplets out into the air. And the second main function of the mask is that you don't touch your nose and your mouth. But but if you have the discipline not to touch your nose and your mouth, and you have the discipline to wash your hands, that is just as good as the mask. But the mask really prevents you from touching your nose and your mouth, and the mask also prevents you from seizing the droplets out into the atmosphere. And if you have at least a meter from the person in terms of the space, you'd be pretty much okay there, because the droplets can be on surfaces as well. So when you're going to be touching the surfaces, that is when you have to keep washing your hands. But that's about hand hygiene. These are the 5 main. I'll tell them to you again because they're very important. After blowing your nose, sneezing or coughing, when caring for the sick, before, during, and after you prepare food, before eating, when hands are dirty, and after handling animal or animal waste. And preferably for 20 seconds, and the sanitizers are just as good. Those of you who might visit the Douglas Charles, you'll see we have the automatic hand sanitizers where you just put your hand, you don't have to touch anything. So make use of them if at all you do travel at the Douglas Charles. You'll see them all over the place, and they'll be at the other ports as well. And when you get to the Douglas Charles, you'll see our PSAs, that's our public service announcements, on the screen as well. So you can also make sure you just listen to them or take a look and see what's happening as well. But yeah, that was beyond your question.
Any other questions, please?
Okay, good day. I want to find out what is the range of temperature ideal for the survival and transfer of this virus.
We will take 3 questions and then we'll have a... Yes,
I would like to know your recommendation, Dr. McIntyre, with regards to handshaking. I think that most of us would be very concerned, especially with you all as ministers and also the Honorable Prime Minister. You all are meeting people on a daily basis, foreigners and foreign dignitaries, but also ourselves, among ourselves, families, friends. What is the recommendation with regards to handshaking? I remember some time ago we had a situation where we had stopped shaking hands, even in church, and you would bump elbows or just acknowledge, was SARS, I believe it was. So is there any particular recommendation with regards to handshaking moving forward?
Thank you. Given that the symptoms are very similar to everything from a mild cold to a more severe flu, at what point do you recommend that people seek medical attention, especially because the incubation period is quite long and that apparently the virus can be passed without symptoms being shown?
Yes, just a follow-up to that question. How do you then prevent individuals who have symptoms from showing up at the emergency room? Because I know in some countries what they've done is ask individuals to call a number and then the process is explained. But if someone comes into the emergency room or to the health center with the symptoms, how do you prevent that from happening? I'm not sure.
You can come? Okay. 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 In terms of the handshaking, well, this one, how do I put it? In the sense that you're going to be meeting people every now and then, and we're not going to be wearing gloves the same way we haven't been recommending masks for everyone. So that way is just repeated washing of your hands, which I said a while ago has to be a habit. You're going into a public place, you're going to be opening doors, you're going to be turning knobs, someone just blew their nose, you wouldn't have known anyway. So there's no fixed thing to tell you that every time you need to wash your hands, you just have to get into the habit of washing your hands. Because here you are, your hands now touching the table. No one knows who was there before, if they touch their nose. So to have a protocol to say that, well, you wash your hands every so once after this, it's very difficult to pinpoint a specific. Neither has PAHO done that, or WHO done that, or CAFA done that, for the same reason why I'm not doing that to tell you, and I think you should just make it a habit. Right? Because it's, some people decide, well, let's give a knocks instead, some give in the elbows. The latest one I heard was the feet, but it's just, you know, at your discretion to just protect yourself and get into the habit of just washing your hands when you get into public places And that is maybe the best way. But to say there's a specific protocol as to when you wash your hands and stuff, I think just the habit would do, rather than just any other particular way. As regards the point someone mentioned about when do you get to the emergency room, because if we're dealing with this, we have to realize the history part is also significant. If someone were to come from one of the hotspots, well, the People's Republic of China or any of the other hotspots, and then there are symptoms, then that person obviously you'd have to take more seriously than someone who has absolutely no history of being in those areas. So at the moment, there's the H1N1 flu going around, so many people have a flu now. If you were to decide you're going to test everybody for flu now, you might be, not really wasting resources, but it's just not practical to be testing everybody for flu now, particularly people who don't have a travel history and who've not been to any of these hotspots. But the symptoms, because you have to realize the coronavirus, the receptors are specific for the lungs. So most of the infection is going to be related to the lungs. So sometimes somebody come with body pain and they don't have a respiratory aspect to it. So then I might not be suspicious of that person because I know the coronavirus is more specific for the lungs and they'll have some respiratory symptoms. So all of this is taken into the history, whether it's the travel history, whether it's the contact history, whether it's the symptomatology, before we can decide, yes, we're going to isolate, we're going to take that person aside and to do those separate testings for those different things. But obviously there's no hard and fast rule to know that you don't really have a suspicious case of it. But we have to consider the travel history, you have to consider the symptomatology, and all of these things before you can decide, well, yes, we're going to take this person aside and to screen separately and to test for the coronavirus. Dr. Ami, do you want to add anything to this as regards to that part here?
Probably the first question. I just want to add to that that in terms of the virus, if it is on the surface, it's stay alive few days. There is no such temperature measure as to say what temperature is going to kill it. Once the surface dries up, the virus actually disappears. There is no traces of, you cannot contaminate anything anywhere. So in addition to what Dr. McIntyre said, that if someone is severely sick, there is a progression to the disease itself. Unlike Ebola virus, there is a chance that 80%, over 60% chance that once you get it, 60% chance you'll die. This is not so with the coronavirus. There is a natural progression of mild to severe from at least 5 days if you're untreated, if you're not managed properly. And then another 2 to 3 days, if not managed, will progress into severe and critical. So it is not, there is a time period in terms of the disease itself. As I mentioned in my presentation, 85% or 80% is actually mild symptoms where they are treated and gone home right away. Some are required, much more rehabilitation and then went home. Severe form required more than weeks to recover. So these are the factors. One other thing I want to say, the hotline, we have hotline if any scenario, any situation, there is one suspect cases, then they are asked to call the hotline and then someone will assist. Someone will assist any form or shape. So the hotline number is 448-2151. 448-2151. In terms of mask types, WHO and PAHO recommendation is that general public should not wear the mask. There is a false sense of security in terms of wearing the mask. So you may think that you put the mask on and then you are safe from contracting the disease. Eventually, actually, because it actually gives you some attention to it, you're going to fix the mask more often, and then in the process, you're going to contaminate your mucus, your nose, you're going to touch everywhere in your face. So it is recommended the health professionals, those who are going to deal with the patients, are required to wear mask. And their recommendation is N95 mask is preferred to to wear, and then especially the frontline workers and the healthcare professionals. Any other question or clarification?
The N95 masks which Dr. Amit spoke about, these are the ones we have in stock besides the normal surgical masks, and these are the ones we're actually getting more of those ones. So that's just to protect us even better, since these are the ones that are recommended by the WHO and the PAO. So we're actually getting more of those masks, and so that we can be in a much better position. Also, just to update you, earlier this week, we had a look with DASPA and the pre-Conco people and the Ministry of Planning. So we're actually going to set up a permanent structure. We had a structure previously, and it got destroyed in Hurricane Maria. So we're setting up a permanent structure, which we're going to use for screening and isolation, and it should be up by next weekend. So that makes getting us even better prepared, that we can have a separate. That is where the port health officer will be, and that's where the nurses will be, so that if in the case that we have to see anyone, this person is brought across to that facility. It's higher up the Douglas Charles, away from the main activity, and that's where screening and isolation can be done. So, and that will be a permanent structure that in the future, whether it's years down the line, it will be a proper concrete structure that can be used. And that should be ready by the end of next week, hopefully. So these are just things that are going. As I said, it's fluid, so we just keep making the preparedness level even better and better as time goes along.
Yes, I got the question right now. When do you seek medical attention? At this time, as you all know, we don't have coronavirus in Dominica. So in that scenario, you are asked to assist Ministry of Health to come to you, actually, to do the screening process, to do the contact tracing. Assume that your child or children coming from the hotspot, especially, please give us some information, and our health professionals will visit you. And in that process, they will do necessary protocols that's required for that individual. In the event that we have in-country transmission already, and everyone has that virus, or most people, God forbid, we will have better update at that point when you should seek medical care. In scenario like this, in severe form, of course, we have to do the surveillance for everybody. So be it mild, be it severe. So any reason you feel like that you have flu-like illness at that point during the outbreak scenario in country, then you need to call our health care professionals or go to health facilities and present yourself. Do not wait and determine yourself. Our healthcare professionals will advise you at that point what to do. Can you do home care? Can we do an isolation? Or should you need to be hospitalized in that scenario? So I hope I answered that question, hopefully.
Thank you, Chair. Somebody shared some information with me. It could be fake news. But I'm just raising it. It has to do with temperature. The person said that the virus is likely to survive in cold countries better than in warm countries. So we in the Caribbean may be fortunate. It could be fake news, but I don't know if there's any explanation, clarification.
Well, the truth is, Mr. Gregoire, the virus has been found in both temperate and tropical countries. So the question as to whether it survives more in cold as compared to warm, it has shown to be surviving in both. So you just have to be prepared. That's the bottom line. Yeah, but the scientists might tell you something else. Maybe it provides a few seconds more in cold than as to warm. The bottom line, it survives in both, and we should get prepared for the virus. I think that's the best way to look at it. So even if it were to survive more in the cold, we've had it in tropical countries, so we should just protect ourselves. Yes.
I want to thank all of our presenters and to thank all of you for your questions. Let us make use of the information given to us. In respect to the protocols that you asked about, Mr. Piper, these protocols will be posted on the government's website. As Dr. McIntyre indicated, there was a review of those protocols at the meeting on Sunday. With PAHO and with CAFA and all of the health stakeholders. There were some questions which each country needed to clarify, and I think the Ministry of Health has been able to clarify those, and then this will be inputted into the final protocol document. This protocol document will guide customs and immigration, the diaspora as to how do we treat with ships, how do we treat with flights coming in, how do we treat with passengers, and if someone is suspected, what protocol do you follow? And it's important that everybody is seized with these facts and these protocols, so that it places us in a much better situation if more people have the information and more people are informed and in tune to the facts as they ought to be. Again, these consultations will continue. There may very well be another NEPO meeting, so we'll keep you informed. They will continue to, as Dr. McIntyre indicated, to be public education exercises at the schools, at the various public and private sector entities. And if there are private sector firms who would want the Ministry of Health to come in and to do a presentation for your staff, we are open to that. So any community who would want to know, the Ministry of Health is more than prepared to come in and to facilitate those discussions and those workshops, because our aim here is to arm every citizen with the proper information, with the accurate information, and so while we all continue to pray for the better, we also have to prepare. So we'll take it to the Lord in prayer and supplication, but again, we have to do what we need to do to prevent this from coming here. Again, I want to commend the efforts of the Minister for Health and his entire health team, the CEO of DASPA and his team, the customs, the control of customs and the customs officers, the head of immigration and all immigration officials, the people who work at the various ports of entry, the fire and ambulance service. I want to commend all of the stakeholders for their understanding, for their cooperation and their collaboration. If we do not have that, then our efforts to properly secure ourselves, because Dominica is not a name because of its mountains and so on, because we have people residing there, and all of us reside there, and therefore we all have to play our part and so forth, and to do this. That's why it's important. Yes, we have the advanced passenger information system that tells us who is coming into Dominica in advance of the plane landing, but again, we have the ANS de Maze, we have the car bricks, we have the bag dust taking place from time to time. We have the stowaway on fresh produce boats that go to St. Martin and St. Bart's and elsewhere. It's important for us for you to inform the authorities if you know of somebody who is coming not through the official ports of entry. And I mean, we have to be practical with these things, and so that when you inform the authorities, you're in fact protecting yourself, and you're protecting your family and the wider community. So I want to thank all of you for being here. Let us continue to work together. I believe that the world will overcome this challenge. We overcame the challenge with SARS and other viruses in the past, and we will no doubt overcome this. Obviously, it will take some time, but the global community has recognized that this is not about China alone. This is about the world. As the WHO said from very early on, that this is a global issue, and there must be a global response. And we in CARICOM, we continue to take this matter very seriously, and there is a regular engagement at various levels, at the stakeholder level, at the technical level, at the ministers level, also at the heads of government level, because there's going to be coordination. We have very, very porous borders in the region, and anything can happen. And if anything can happen, then we have to be prepared for everything. And this is what the Ministry of Health, this is what the government is seeking to do, is to prepare for any possibility, any eventuality, as best as we can. And as was indicated earlier, there's no foolproof system, there's no perfect system, but at least we utilize all of the resources that we have, human or otherwise, and to ensure that we can prepare ourselves. I want to specifically commend the efforts also of Dr. Ahmed, who has been really, really exceptional. You know, he doesn't speak much. You know, he's unassuming, but he is an exceptional public servant, and I really want to commend his leadership and his guidance. And also, I want to specifically point out the nurses at the district level, at the Dominica China Friendship Hospital, the nursing administrators, because without the understanding and without the cooperation of the nurses, all of what we put in place would come to naught. Because at the end of the day, if anything were to happen, if there's a suspected case, if we have to put people in quarantine, they're the ones who have to do the necessary chemistry of these patients, and they're the ones who are really at the exposure. So I don't want to call names because I have to call all of the nurses in Dominica, but just to say that we appreciate that understanding, and that's what needed. That's what needed. You know, this is our country. We have a responsibility. We have a duty. We have to carry it out to the best of our abilities. Because as I say to people all the time, as it's written in the Bible, when the good Lord comes back to judge the living and the dead, He's not going to ask us how many times we went to church. He's going to ask us how many times we pray. He's going to ask us, what have you done for the least of my brothers? And the question is, how would each of us be able to answer this question? Are we going to say, well, you know, I prayed every day and, you know, I went to church every day? That's not going to, that might add a little 1% to your penance, but that will not get you into the pearly gates of heaven. And what's going to get you in the pearly gates of heaven is doing things to the least of your brothers, because when you do it to the least of your brothers, you do it unto the Lord. So those of you who read the Bible every day, I applaud you, but if you don't practice these beatitudes and so on, you really are falling short of the graces of the Lord and so on. But I leave it to the Lord to judge that and so on. I am just interpreting what is written in the good book. Thank you very much. May God bless all our efforts. May God bless our country, and we wish also to extend, on behalf of the government and our citizens and residents, our condolences and sympathies and empathies to all of these countries that have been impacted. You know, in Italy, I've read the news that they have to close universities and schools. You know, one can appreciate the anxieties of these countries. In Iran, in South Korea, they have had to take some very drastic actions. In China, which is the epicenter of this, you know, we do not wish this on anybody, and we can only pray for these countries and for the leadership of these countries and for the citizens of these countries, and whatever moral support we can provide, we have been doing so as a government on behalf of all the people of Dominica. So I wish you all the best. May God bless you. Have a good evening. Thank you very much.